fat in the liver dangerous? What do you feel when you have fat in the liver? What are the 8 warning signs of hepatic steatosis that indicate liver fat has become concerning? And more importantly, what can you do to eliminate that fat before it's too late? Today, I will talk about liver fat, a rapidly increasing condition worldwide. In the past, hepatic steatosis was diagnosed very infrequently, specifically during the 1990s. Today, it is rather widespread and can be observed not only in adults, but in children as well. In Spain, more than 30% of adult population above the age of 35 years poses this disease. But do not think of this as a light illness. If not treated, it can result into scarring, cirrhosis, and even cancer. Just to get an idea of the size of the problem, steatosis is among some of the causes of liver transplant surgeries in the world. You would not afford to ignore it, would you? This is why liver disease should be diagnosed at an early stage, because the liver can rebuild itself to a certain degree. By recognizing the symptoms, it is possible to arrest the ailment, stop it from getting worse, and even to reverse the effects in order to maintain healthy liver. I will not only speak about the 8 signs and symptoms in the next video, I will also discuss on the major food that leads to this fat deposits in the liver. I will also demonstrate that this issue can be naturally eliminated with the help of some changes in the habits of a person. You will also learn about the wonderful home remedies for fatty liver that are probably in your kitchen than in the store. Want to know more? Stay until the end and tell me, do you have fat in the liver? From where are you watching this video? Write in the comments below. Now follow me. What are the 8 symptoms of fatty liver that you can't ignore? But first, let me assure you that a lot of people have no idea that they have a fatty liver. 1/3 of the adult population has liver fat, yet many of these people have no idea until they have an ultrasound for some other ailment, and the radiologist performing the ultrasound tells the patient, your liver is full of fat, while the patient thought they were healthy. Initially, hepatic steatosis is an asymptomatic condition, similar to diabetes, cholesterol, or hypertension. As the old Chinese saying goes, if you do not look for it, you will not find it. But if it happens to you, if you become afflicted, do not despair. As I was saying, the liver possesses this great ability to regenerate. I think it is the only organ that can regenerate this way. Let's get into the symptoms. First symptom, fatigue. Why is there fatigue? The liver is known for detoxifying the body and metabolizing nutrients and for creating energy in the body. When your liver has fat, then your metabolism is going to be affected in one way or the other. If you already get steatohepatitis, there is inflammation of the liver and fat deposits. You will be even more tired. Also, liver synthesizes hormones that regulate energy, mood, and sleep, meaning you will feel tired. Second symptom, pain in abdomen and burning sensation in chest. Dyspeptic symptoms such as acidity, heartburn, often reaching the throat, irritation, burping, and the feeling of a full stomach are much more frequent in people with hepatic steatosis than in those who do not have it. And the feeling of a full stomach are much more frequent in people with hepatic steatosis than in those who do not have it. 25% versus 12.4%, according to a study by UFMG. Third symptom, excess gas. It is important to note that hepatic steatosis can have a very common and noticeable symptom in patients. We hear radiologists use this phrase frequently. Those who have fat in the liver are full of gas. Sometimes you cannot even observe the pancreas due to the formation of adhesions in the abdominal cavity. This excess gas is likely due to alterations in the composition of organisms in the gut. Fourth symptom of liver fat, stomach ache in the right side of the abdomen just below the ribs, and an uncomfortable feeling in the upper right part of the stomach as a warning. A vague, dull discomfort in the region of the liver, a pain in the right side under the ribs, which might be due to enlargement of the liver and pressure on some nerves, particularly the phrenic nerve, which would result in a pain around the right shoulder. Fifth symptom, rash and itching all over the body. If the disease is already severe and the liver is equally affected, then there is a tendency that bile salts may enter the bloodstream and deposit in the skin, which results to itching particularly on the palms of the hands. But the itching can be experienced all over the body. How does it feel watching the video? Give it a like. Do not be lazy and get a subscription to our channel so you do not miss our tips on health issues. Sixth symptom, jaundice. It is possible that your skin and the whites of your eyes may become somewhat jaundiced or take on a yellowish coloration. This is called jaundice. Stools may be reduced in color and form, white, fecal alocalia, while the urine changes to dark red, like Coca-Cola. Seventh symptom, skin rashes of violet color. When the liver fails to manufacture the proteins, coagulants to clot the blood, it may lead to platelets decrease, which is thrombocytopenia. Platelets aid in clotting of blood and your small intestine may not properly assimilate fat-soluble vitamins, and therefore you may develop a deficiency of vitamin K, which is vital in clotting. Thus, purple spots are seen to start appearing all over the skin. 8th symptom, spider veins. The body will have hormonal changes with estrogen build up in the body. The liver fails to metabolize estrogen properly, and this results to the dilation of the blood vessels. Regarding this hormonal change, a man may grow breasts, gynecomastia, lose hair on his legs, and have red hands. Other symptoms, night blindness. Vitamin A is also a fat-soluble vitamin like vitamins D, E, and K are also known to be fat-soluble vitamins. If one's body is unable to properly assimilate vitamin A, the eyes will not be able to compensate for the lack of light, and this leads to night blindness. Therefore, it is crucial to at least be aware of signs, and if you experience the symptoms above, do not hesitate to get medical help. How can you find out if you have liver fat? As I mentioned, you can get a liver ultrasound to see if the liver has fat infiltration, but also through CT scans or MRIs. Hepatic steatosis has 3 grades. Grade 1, mild steatosis, Grade 2, moderate steatosis, and Grade 3 when there is a large accumulation of fat in the liver. Non-alcoholic fatty liver disease is present when the liver contains more than 5% fat, and most patients with liver fat are either overweight or obese. This implies that only 5% of the population had a normal weight. Another risk factor is type 2 diabetes and hypertension 71. Those risk factors include high cholesterol and/or high triglycerides, also known as dyslipidemia, and excessive alcohol consumption. Other contributory factors include a sedentary lifestyle, the use of analgesics such as paracetamol and ibuprofen, selective estrogen receptor modulators including tamoxifen, and corticosteroids. What measures can one take to get rid of this liver fat? 1. Do not drink alcohol. Avoid alcohol consumption because it is toxic to liver cells and results in the production of toxic compounds. 2. Lose weight. As you shed 5% of your total body weight, you can reduce inflammation in your liver, decrease fibrosis, and minimize fat accumulation in the liver. 3. Follow a healthy diet. The leading culprit for liver fat accumulation is high fructose corn syrup, which is present in products such as sodas, cereal bars, boxed juices, ketchup, mustard, and jams. In this year's Obesity, a journal by the University of Colorado, the excess fructose is to blame. So, do not consume the foods I pointed, and instead of taking fruit juice, it is better to have the whole fruit. Juice contains a lot of fructose, but whole fruits are much healthier for the body. Avoid sugar. It was also found to cause liver fat and increase obesity risk. Undefined. These are foods that most people consume as fast foods, and these have a lot of fructose, sugar, salt, and unhealthy fats, which are not best for the liver. Another food to avoid is refined wheat. Bread, pasta, cookies, all increase the risk of liver fat. 5th, avoid vegetable oils. Today's diets are rich in omega-6, which causes inflammation, and lack omega-3, which reduces inflammation. Now, here are 6 types of foods you should include in your diet. 1. Fruits. Fruits contain fructose, but consuming fruits do not lead to fatty liver. There are even some other researches which indicate fruits decrease liver fat. The best fruit that can help in reducing the liver fat is avocado, which is rich in glutathione. 2. Whole foods. Oats, flaxseed, and chia are all high in fiber, and flaxseed and chia are full of omega-3. 3. Vegetables. These include broccoli, cauliflower, and Brussels sprouts, which are high in sulfur and help to decrease inflammation and liver cancer. Another source of sulfur is the food items such as garlic, which contains allicin, a bioactive compound which is created when garlic is chopped, crushed, or even chewed. This is because taking raw garlic daily reduces the chances of liver cancer. 4. Olive oil. Intake of 3 to 4 tablespoons of olive oil in a day can help in minimizing liver fat accumulation. Sprinkle it over your salad, use it as a topping to avocado or broccoli, or even with garlic. 5. Turmeric. Turmeric has anti-inflammatory properties. It can be taken with a pinch of black pepper or with healthy fats such as avocado and olive oil. In this way, the absorption rate of curcumin in the intestine is raised up to 2,000 times. 6. Coffee. If there is something that most people love to take especially in the morning, then it is coffee. In addition to caffeine, the beverage contains tocopherol, which is a form of vitamin E and chlorogenic acid, which is an antioxidant that helps alleviate liver inflammation and may even prevent liver fibrosis. However, do not add sugar in it because this would cancel the positive impact of coffee on the liver. Fatty liver disease is highly prevalent, and if not treated early, it could lead to serious complications. Some of the signs include fatigue, abdominal pain, and digestive problems that, if not checked, could lead to jaundice and purple spots on the skin. However, fatty liver disease can be reversed if certain healthy practices are observed. Some foods should be avoided, including processed foods, sugar, and fructose. Instead, you should increase your intake of whole fruits, whole grains, cruciferous vegetables, olive oil, turmeric, and coffee without sugar. Remember, the health of your liver is in your hands. With small changes in your diet and lifestyle, you can make a big difference. Don't wait for the symptoms to worsen. Regularly, consult your doctor and follow these tips to keep your liver healthy. Like this video, share it with your friends and family, and subscribe to the channel for more health tips. See you in the next video!